All right, welcome everyone to today's webinar on thyroid breakthrough. So we're going to be discussing about the thyroid and autoimmune disease and how that can affect people's health. So looks like we're still waiting on a few people to sign in. We'll give it just another minute before we actually get started here. All right, very good. So we may have a few more people jumping on as we're going here, but let's go ahead and get started with the presentation today. So I am Dr. Chris Jones. I'm the clinical director at the Tyler Wellness Center. We are located in Tyler, Texas, and we focus strictly on health and wellness. So we're helping people with certain chronic diseases like autoimmune disease, thyroid issues, weight loss resistance, diabetes, fatigue, brain fog, you name it, digestive issues. We're helping people with those types of problems and giving people more of a natural approach to their health care. So let's jump in. So who here would like to not end up fat, sick, and generally depressed? Hopefully everybody listening is not wanting to end up like that. Unfortunately, that's where I see a lot of people ending up. Okay, so today we're going to discuss how we get the results that we do. The key is you have to have a systematic approach. You have to have a systematic approach. Okay, and if it makes sense, you'll be able to move forward after this webinar. If not, hopefully you learn a little bit. You take some information away from here, and you can better your health in some way. Okay, so whether you're on this webinar today because of stubborn weight loss, maybe it's hormone imbalances, diabetes, thyroid issues, poor blood labs, brain fog, fatigue, or just not feeling right, you'll begin to understand the fundamentals of why our current health system is failing us and what we can do to start making it work for us. I like to identify a little bit about who I am. First off, I'm not the one that heals you. I don't treat or cure any diseases. And that may sound funny, but just stick with me here, and I think you'll understand more what I'm talking about as we go along. That's not to say that our patients don't get the results that they came for. They absolutely do. They lose weight. They get their diabetes turned around. They get their hormone imbalances worked out. And yes, even digestive issues, we get those smoothed out as well. I'm not a conventional medical doctor or an allopathic. I'm not an endocrinologist or a psychologist or a neurologist. My doctorate is in chiropractic, which I received back in 2010, with postgraduate studies in functional nutrition, functional blood chemistry, and functional neurology. So the practice that I've chosen here in Tyler works with functional nutrition and lifestyle in order to help you change your entire internal health and well-being. So what I want to do now is kind of compare our current healthcare system versus how we do things in my clinic. Does anybody know what an endocrinologist does? Chances are, if you've been diagnosed with diabetes or some type of thyroid issue, you have been to an endocrinologist, okay? They're working with diabetics and thyroid sufferers. They work with glands and hormones mainly. Does anybody know how you get an appointment with an endocrinologist? You can't just walk in. You have to be what? You have to be referred, right? So you have to get a referral, usually from your primary care doc, because there's a current problem. So there is already an issue that's present. And once you're referred, does anybody know the typical treatment? Medications, hormones, like Synthroid, metformin, and so on. Okay, so it's medications and hormones. My question today, is that acting on the underlying problem, or is it just acting on the end result? I think we know it's acting on the end result. Is it acting on the cause, the true underlying cause, or is it just treating the symptoms? We all know that it's not addressing the underlying cause. Are you going to correct the body's dysfunctions by doing that? Absolutely not. Wouldn't it be better to go to the endocrinologist before the problem actually arises? That's what we need to do, right? Wouldn't it be better to address the cause before it becomes a bigger problem? Absolutely. But unfortunately, that's not what happens. So, functional endocrinology. Functional endocrinology, that is what I do, and that is focused on improving function, acting on the cause, not just treating the symptoms. So here's an example. Let's say you have a blood sugar problem with insulin resistance to the point of diabetes. We're going to make some improvements in diet, exercise, and functional nutrition, and we're going to turn this whole thing around. And we're going to prove it out with blood work, so you don't have to take metformin anymore. Okay? Hopefully that makes a little more sense. It's thinking about the problem, whether it's digestive issues or thyroid issues, whether it is headaches, whatever it may be, we have to dig deeper with medical testing, proper medical testing, to uncover the root causes of why these symptoms are happening. We have symptoms for a reason. We absolutely do. And thankfully we do have these symptoms because it's our body's sign of, it's the body's way of telling us that something is not going right. But we don't want to mask it. We don't want to just cover it up with medication. We got to dig deeper. So everybody be honest with me for just a second here. And if I'm doing this live, I like to have people raise their hand if they're taking a medication. And it's always surprising. Well, not really surprising anymore, but it's shocking, I should say, that that most of the room is usually taking at least one, if not two or three medications. Do you all believe that that might create some health issues and health problems? Do you believe that pharmaceuticals will actually resolve the underlying health problem? I don't. Do you think if we correct lifestyle, we could actually get to the bottom of this? Absolutely. Okay. This is a really cool picture. I love this picture. It shows what we do with functional medicine, and it's really a good visual of how modern medicine and allopathic medicine and drugs and medications is different than the way we look at things. So it just comes down to a philosophical difference, MDs versus what we do as functional medicine practitioners. So the things on the top: high blood pressure, the heart disease, cancer, autoimmune disease, anxiety, depression, these are all of the symptoms. Okay, these are all of the diagnoses, if you will. All right, and modern medicine has gotten to the point that it just wants to cover these things up and try to make that symptom go away. Okay, and the drugs and medication, unfortunately, are not addressing these underlying problems, which you see below the earth, obviously: the inflammation, the stress, the poor diet, the nutrient deficiencies, lack of exercise. The medication does not address any of these root problems, and that is the issue. That's why so many people are in such bad health. Okay, so just a great example of what we do and how we have to dig deeper and uncover these root problems. Okay, guys, we just talked about the issue. It's insurance. It's there's a lot of money behind drugs and medications, and they're just being pushed for all the wrong reasons. Now, don't get me wrong, medicine has its place. Thankfully, I wouldn't want to be anywhere else than in America for an acute problem, an infection, some type of severe, flu or sickness. Maybe it's a broken bone or a bad car wreck. Our healthcare there's none better in the world. But when you have medical doctors treating patients for chronic disease using medicine that's designed for acute care, that's where we have the issue. That's the problem. Okay. So a good quote here, 85% of all medical procedures and surgeries are scientifically unproven, according to the British Medical Journal. 90% of all diseases prevalent today are not treatable with orthodox medical procedures. Pretty eye-opening. Okay. All right. This is sad but true. A lot of us, we're just getting the wrong information. Okay. We see something like this on TV, where there's a good-looking buff guy, there's a good-looking gal on the commercial, and they seem to have it all going on, right? They're in shape, they're fit, they're good-looking, and they're promoting something like this. So this is an ab lounge, and I was in Goodwill a couple months ago, and I actually saw one of these for $1. Okay, and I'm sure somebody bought into it. They fell into the trap. They bought this thing online or on TV, got it home, and they started away, and unfortunately not noticing any results. Okay, so we just get the wrong information, and there's all kinds of marketing and gimmicks out there that people can buy into, but it's tough to decipher sometimes what's true and what's not. But if I told you the correct way to exercise and that it only took 20 to 30 minutes 2 to 3 times a week, would that be acceptable? I hope so. It should be. 20 to 30 minutes, 2 to 3 times a week, doing it the right way. You have to put some muscle on your body. 1 pound of muscle is an extra 1,500 calories burned. So how does 5 extra pounds of muscle sound? I think most of us here would sign up for that, right? So 5 extra pounds of muscle to burn extra calories. That's burning an extra 7,500 calories a month. But again, we got to do it the right way. So resistance training is an excellent way for us to get better results. Okay. This is another part of the problem, right? We're not being proactive. So unfortunately, this is some folks' idea of going to get the mail, okay? Or I took my dog for a walk, right? Man, I really hope there's not people out there doing this, but who knows? There may be. But we just as a society, we're not proactive, and we need to start being proactive. We have to take our health into our own hands. We have to. Okay. The purpose of food, that which is eaten to sustain life, provide energy, and promote the growth and repair of tissues. Okay, so the example that I'm going to give is, let's take somebody that's on a 1,200 calorie processed food diet versus somebody that's on a 2,000 calorie whole foods diet. And at the end of the year, who will have higher body fat percentage? It's going to be the 1,200 calorie processed food diet, right? They're eating junk, guys. Can't buy into the fact that it doesn't matter what you're eating, just count the calories, Guys, unfortunately, that does not work. You have to pay attention to the food. The nutrient, the content is very, very important. So 1,200 calorie processed food diet is going to have higher body fat percentage than a 2,000 calorie whole food diet. It's not strictly about the calories. If it is synthetic or processed food, it's junk. Okay? Same thing applies for vitamins. If it's synthetic or man-made, Vitamins, it's junk. And guys, it's bad out there. CVS, Walgreens, Walmart, Sam's Club, you got to be careful. Even GNC, you've got to be careful. A lot of these supplements are man-made synthetic vitamins that can be toxic to the body and to the liver. Okay, so just watch out for that. You need to look for 100% plant-based supplements. So this is nutrients from plants and herbs as opposed to synthetically made in a chemistry lab. All right, talk a little bit about hormones and their importance. Okay, so there's fat-burning hormones. I think everybody here would sign up for more of those, right? But there's also fat-storing hormones. Question is, do we need these fat-storing hormones? Insulin, estrogen, and cortisol. We absolutely do. We've got to have them. Okay, we just need them in the right balance. So we need insulin and estrogen and cortisol, but they've got to be in balance. If they're out of balance, we're going to have issues. We're going to have symptoms. Okay. Now, it's a cool slide. It kind of differentiates between common issues that we see in our office. Which body type are you? So the first one, estrogen dominant, you're going to see larger hips and breasts, and this is an imbalance of estrogen and testosterone. Okay, the second one is an adrenal imbalance. This is cortisol and DHEA typically being too low or too high due to stress. This is going to be a bigger stomach and skinny little bird legs. You've got to get these hormones under control in this case. There's the thyroid, which is what we're going to discuss more in detail in just a few minutes. But the thyroid presentation is just a general puffiness, a general swelling throughout the body. Okay, and then the last one is the liver, a big old gut, right? We call that ascites. Question is, what are the two biggest things that cause the most damage to the liver? It's your drugs, your medications, right, and alcohol. Okay, so those are the big inflammatory issues for the liver that we've got to be careful with. Can you get healthy if your liver is backed up? No. Okay, you can, but you've got to eat right and detoxify. Okay, can you get healthy if your hormones are out of whack? No. Okay, you've got to address that issue before you can get healthy. And can you find the motivation to make these changes by yourself if you're suffering from any of these issues or adrenal fatigue? I have found that it's not very likely. You will need a motivator. You will need accountability. You will need a mentor, somebody to help walk you through this process to health. Okay, that has proven time and time again to be the most successful way about it. Okay, now we've got the thyroid slide here, and so why your lab tests are normal but you still have symptoms. I don't know if that describes anybody listening, but I hear that on a daily basis in my office. So I've been to my doctor's tested me once or twice a year, and he says that my thyroid numbers, my thyroid labs are fine. My thyroid labs are normal. Gives me a pat on the back and tells me he'll see me in 6 months or a year. Okay, but guys, they're not testing the full panel. They're not testing to see the full story of the thyroid and the thyroid hormones. Okay, so I hope to shed a little light on that here to give a little bit better understanding, just a basic understanding of how this works. So you go to your doctor for, say, a yearly checkup, and you're suspecting thyroid issues. Okay, maybe you've got brittle nails, your hair's thinning, it's dry and wiry, hair's thinning, falling out, you're lethargic, maybe you're dealing with brain fog, gaining weight that just doesn't seem to come off. You wake up and you feel like you just fell asleep, you're not rested in the morning, you wake up lethargic and just not having that zest and that energy for life. Guys, these can all be thyroid symptoms, okay? But the problem is you go to your medical doctor and they just do a very basic blood panel. They're just scratching the surface, okay? When they check a yearly well checkup, typically they're only going to look at TSH and T4, which you see on the screen. TSH and T4, guys, it's just the tip of the iceberg. As I said, they're scratching the surface. That's 2 markers for the thyroid. There's 10 total markers that we look at when we help our patients. 10 total markers, okay? So that paints a complete picture. It tells us the whole story behind not just the thyroid, but more importantly, how are these thyroid hormones working in the body? So let's talk about that, okay? So when we run blood work, we're seeing the whole story. We can tell if the body is converting thyroid hormones like it's supposed to. That's the most important thing. The thyroid gets stimulated by thyroid stimulating hormone to produce T4 and T3. Now it produces much more T4. About 93% of what the thyroid makes is T4, while by the remaining 7% is T3. The interesting thing is T3 is inactive. I'm sorry, T3 is the active form, T4 is the inactive form, 97%. So that T4 has to travel throughout the body and other tissues to get converted into the active form, which is T3. Anybody want to guess at the 2 main areas that this happens in the body? T4 conversion to active T3. The main place this happens is the liver and the gut. Okay? Anybody want to take a stab at the 2 most problematic areas that I find in patients? The 2 most inflamed areas where there's just poor health. It's the liver and the gut, guys. It's the liver and the gut. And it makes sense. Every day we're putting junk in, right? We're putting inflammatory foods in day after day, whether it's gluten, dairy, we're putting junk in. And so we get junk out, okay? So due to the inflammation and due to the poor health in the gut and the liver, oftentimes these conversions from T4 to T3 are not happening as well as they should, and therefore it leads to thyroid imbalances, hormone imbalances, okay? Your doctor a lot of times won't see it on the labs because it just, quite frankly, they're handcuffed and they're just not digging deep enough due to poor insurance coverage, okay? But we gotta test, and we need to figure out if there is imbalances and what they may be stemming from. A lot of times we see that it's poor health in the gut and liver, okay? All right. So hopefully that paints a little bit of a clearer picture about, you know, thyroid and thyroid hormones and how those imbalances can happen, and how they can happen, but your doctor's telling you that everything's normal, okay? All right. So let's talk about testosterone for just a minute. I like to use this as an example to explain how we as functional medicine practitioners look at blood work compared to a normal doctor. A normal doctor looks at the pathological range. If you have blood work, maybe you have it sitting there in front of you, you've got your blood work on the right side, they've got the ranges. Those are the pathological ranges. That's a bell curve, it's a pool of all the sick people that are going to the hospitals. Now the crazier part is that it's actually different depending on what region of the country you live in, okay? So it's different depending on what region of the country you live in. I don't want to compare you to sick people. That's not how we get well. So thankfully, doctors, researchers, and scientists have pooled thousands of people that are well, in good health, without taking drugs and medications and not diagnosed with any diseases. People that are healthy and feeling well, and they've come up with better ranges. It's called the optimal range, or the functional range. So that's what we go by. So the example here is a guy, say he's 55 years old, you know, middle of the road, used to like to work out, play golf with his buddies, and do the normal things, okay? But recently, not going to the gym anymore, so he's not noticing any results anyways. He's stopped playing golf with his friends, said he's not noticing, that he's just not enjoying, his hobby, but he's used to. Quite put his finger on it. He goes to his doctor, and his doctor checks his testosterone, and it comes back at 250. Now, this is the pathological range, what doctors go by. 200 to 800 is normal. So he gets a pat on the back, and his doctor tells him he's fine. Okay? But functional medicine looks at testosterone at a different way with healthy individuals. The healthy range is 600 to 800. So if this guy were to come to a functional medicine practitioner and get his testosterone up to, say, 650, do you think he's going to feel better? I'll let the women answer that question. He is absolutely going to feel better, right? He's going to have more drive, more sex drive, just more motivation and more energy to do things. So there's no doubt going to be a difference, okay? Now, cortisol, this is a circadian rhythm hormone, meaning that it's higher in the morning and lower at night. This is a natural thing. It's designed to be higher in the morning to help us wake up and get going, but it drops off low in the evening to help us calm down and relax so that we can get sleep, okay? So some tests are done best through the blood. Others are done best through the saliva. And there's even some that are done best through the stool, which we'll talk about in just a minute. But cortisol happens to be one that's done best through the saliva. We can chart it and see the tissue saturation level. But this example here, a guy or a woman goes to the doctor and gets their cortisol checked through the blood. So they get the result, and it comes back as that snapshot in time there where the blue mark is, and it comes back on the line. So it looks good. They get a good report, right? Their cortisol is fine. But they didn't see the rest of the story. Here's the rest of the story. Their cortisol is bottomed out. It doesn't follow the normal curve. Quite frankly, this is not a good thing. Okay, this is somebody that may be under stress or they're just not feeling good. Maybe they have gut inflammation. Something's driving inflammation in their body that's causing cortisol to drop out. Okay, and with saliva, we can check your cortisol at 4 different times of the day and chart it like you see to make sure that it's following the healthy curve. Okay, so again, some are done best through the blood, some done best through saliva, and others through the stool. We utilize all 3 in our clinic. Okay, if you have $1 million racehorse, right? I spent time in Kentucky. That's where I met my wife. And it's all about horse racing there. And if you've got $1 million racehorse and it's not feeling well or not performing well, one of the first things they do is run a stool test to see where the health of the gut. They need to see the health of the gut to see if there's any infections, bacteria, viruses, funguses that they need to get rid of. Okay. All right. So again, we do all 3: blood work, saliva testing, and stool testing. Okay, and the good thing is these stool and saliva tests are relatively inexpensive. That's another benefit. Okay, so if no one is testing and they're just throwing darts at the dartboard, who's the real guinea pig here? We got to put the missing pieces together, guys. We got to put the missing pieces together. So listen, I've told you today what doesn't work. Now, I think it's fair for me to tell you how to get out of this mess, okay? So you've got to look at the person as a whole. If you're a thyroid patient and you come into our office diagnosed with, let's say, hypothyroidism, for example, You do not just get put in a pool of hypothyroid patients, okay? We have to look at everybody individually and test everybody thoroughly to figure out if there are any other underlying health problems, okay? So you've got to put the pillars of health together. Now, I really stress these 4 or 5 pillars of health. I say 4 or 5 because the nervous system I feel is important, but you know, I don't have to be the chiropractor that addresses that. You can get that help from any chiropractor, but I do think your nervous system, your central nervous system, your brain, your spinal cord, I think are vital to health. Our brain and spinal cord control everything in the body, but I've found that addressing these other issues, nutrient deficiencies, you know, detoxifying properly, addressing fitness and exercise and hormones has quite frankly, just a bigger impact and a longer term impact on your health in a positive way, okay? But they each have their place. So, question, if we want maximized health, is nutrition mandatory? Yes, it absolutely is, okay? If you're eating well but your gut and liver are backed up, can you truly get healthy? You can't. You can't. All right? You have to what? You have to detox, okay? What about your hormones? If you eat right and detox but your hormones are out of whack, can you achieve true health? No, you can't. All right? But the last one here, so what about exercise? That's the 4th one. Can you achieve maximum health without exercise? No, you can't. But thankfully, it only takes 20 to 30 minutes, 2 to 3 times a week. That's all that's needed to do the correct kind of exercise. Now, how are you going to get that information? I strongly prefer to coach and or teach people. Kind of like going through school. It's an education process, okay? It's an education process. So here's how I do things at our clinic. Again, I don't treat or cure or heal anyone. You can't just come into my office and pull out your checkbook and buy your health. But what you can do is I can help you turn everything around and take you through one of our education curriculums, okay? If this makes sense, but you want to, and if it makes sense and you want to move forward, but you want to leave one of the pillars out, will you truly get the best result? You're not. You are not. So in the past, if you've tried supplements or diets but didn't get the results you wanted, you've got to ask yourself, did you incorporate all 4 pillars? So important. Not only, you know, you can't just pick 1 or 2 of them, guys. You've got to incorporate all 4. Detox, balancing hormones, nutrition, and exercise. And was there a solid system intact? If my program didn't have a system, it would also fail. And finally, did you have an instructor, somebody to keep you accountable? Imagine going to fly a plane. Could you fly a plane after reading a book? It'll help, right? You can read a book, you're going to learn a little bit, but you couldn't fly a plane after just simply reading the book. You'd have to go to class, right? You would have flight classes, and eventually there's going to be an instructor, right? And eventually the instructor is actually going to get in the plane with you. Our practice here is no different. Some of what you learn is from reading, some is taught, and some through being mentored or coached. It's very individualized, and it's done through testing, not guessing. We are not going to guess. I don't guess at my wife's health. I don't guess at my patient's health. Okay? So hopefully that sounds good. Here's a quote that I love. Tell me and I may remember. Show me and I will remember. Involve me and I will understand. That's the most important thing. You have to understand. You have to get involved and understand. And that's what we help people do. So what is the most important thing that I've taught you today? Kind of a trick question, but the answer is taking action, okay? You have to act and get involved. Knowledge is power, right? Not entirely. Acting on the knowledge is true wisdom. That's the difference right there. Acting on the knowledge is true wisdom. You have to act. You have to do something. You can tell yourself that the timing's not right, or I don't understand this. I don't think this makes sense. You have to act. You have to get involved to make a difference. I have a quote painted in my office. It's one of my favorite quotes. It says, "Your life does not get better by chance. It gets better by change." You've got to act and get involved. You have to make a change, okay? So you've learned enough today that if this approach makes sense to you, you can make a very important decision today. I'm going to ask that you start helping yourself. What you'll have the opportunity to do is come in for a consultation, but you have to be ready. You cannot be this guy on the couch, okay? You can't keep procrastinating, all right? You got to wake up. You got to wake up and be ready to act, okay? All right, good deal. So let's get this last slide up here. Okay, now what does this do, or what does this look like? Okay, we've got to order the correct test, no question about it. We've got to determine the true underlying cause. We've got to focus on the cause and not the symptoms, right? We got to focus on the roots, the root problems, not just cover up symptoms with Band-Aids and medications. We've got to correct dysfunction, not just alter the labs with drugs. We're going to address the body as a whole, no question about it, and there needs to be a systematic approach, a step-by-step approach to make this implementation easier and more sustainable. And the best way for this to happen is through mentoring. Having somebody there that knows what they're doing, knows the ropes, and can walk you through the process to make sure you're doing it the best way possible. So when you come in, if you're local, you can come into the office. If you're not local, we can still absolutely help you, but it would maybe be over the phone or possibly through like a Skype session or something like that. But when we talk, you will have your paperwork already filled out. If you're interested in an appointment or in a free consultation with me, you're going to get your paperwork in advance. And it's kind of extensive. It's going to take you a good 20, maybe 30 minutes to fill it out. But it's going to give me a lot of good details. And I guarantee you while you're filling it out, you're going to say at some point, man, I wish somebody would have asked me these things a long time ago. Okay? When it comes time for us to have our consultation, we're going to have about 30 minutes to an hour set aside for that initial consultation. Okay? And we're going to sit down and talk about your health concerns, but not only health concerns, we're also going to talk about your health goals and what you want to accomplish with something like this. We will absolutely talk about a plan of action and how long I think it'll take for you to reach your health goals. Okay? All right. So that's a little bit about how that works. I'd just like to kind of end the webinar just walking you through just a couple of the basics here, just to clarify a few things. So this is just a quick recap on what happens from here. If you're interested, I highly recommend that you call our office at 903-944-7951 and schedule either, again, over the phone, over Skype, or if you're close enough to Tyler, you can come into the office. But what will happen at our meeting, at that first meeting, again, we're going to sit down and talk about your health concerns and health goals, and we're going to pour over the paperwork and make sure that we're on the same page. How long will that last? We're going to have a good hour together for that time. Should you bring anything? Absolutely. You're either going to bring it into the office or email it to me, but you're going to have your paperwork filled out so that I can review that prior to the consultation. Was this or is this a sales presentation? Absolutely not. It's designed to be educational. So hopefully, if you're listening to this, you've learned something and maybe even been called to do something about your health. And maybe that's with me and maybe not. But if it is with me, I will be absolutely glad to help you in any way that I can. Where will we meet? Depends on where you're coming from. If you're close to Tyler, you can come to the office. If you're not or have trouble making it here, we can absolutely talk over the phone or with Skype. So then what? After that consultation, 3 things that can happen at our meeting. First one is that we agree to work together to help you reach your health goals. The second is we agree to work together, but your schedule doesn't allow time right now, so we'll set aside a date in the near future. And the third thing, if you're local, it's clear that this isn't a good fit. You start throwing things at me, you grab your stuff and knock the chairs over as you run out of the door. Okay? Now hopefully that doesn't happen, but we'll see. I still haven't had that happen yet. So guys, I appreciate you taking the time to listen. I hope that this has been informational and educational. I just want you to know that we're here for you. If you need guidance, if you need help, if you're wanting to dig deeper to uncover the true underlying causes of why you're not feeling as good as you should, please reach out to us. We would be happy to help. If we can't help, we're going to point you in the right direction. Okay? All right. Thank you, guys.